the Head of Border Force and the Chief Medical Officer, Professor Brendan Murphy, to provide an update on the coronavirus, its passage and the Australian protective and precautionary response following up from the Prime Minister's announcement in relation to the National Security Committee decisions of yesterday. In relation to the virus, the latest advice we have is that globally 11,939 cases have been confirmed, although we expect new figures during the course of today from the WHO and international authorities. Sadly, that's been accompanied by 259 lives lost, and again we expect an update on those figures today. In relation to Australia, and I have confirmed all of these figures with the Chief Health and Medical Officers and State and Territory Health Ministers this morning, there are 12 cases that have been confirmed as being diagnosed within Australia. I can report, however, that New South Wales has indicated a third patient has been discharged from hospital as having cleared the virus, and I think that's a very important sign of progress, and I'll let the Chief Medical Officer address the medical significance of that, but I think to the Australian people to understand that patients are clearing the virus and being discharged is a significant milestone. In terms of implementation of the National Security Committee decision, we have convened a teleconference this morning of all state and territory health ministers, their chief health officers and their departmental secretaries. All states and territories were in attendance to update on implementation of the National Security Committee decisions of yesterday. And I want to thank our colleagues and all of the officials and agencies across the country. The report which the state and territory ministers gave was that the decisions of yesterday in relation to the border protections are being implemented, and Commissioner Outram will give more advice, but at the airports masks and screening processes have been carried out and carried out very smoothly. It's an extraordinary testimony to the preparedness as well as the implementation capacity of the Commonwealth states and territories led by our agencies working together. I know that overnight the National Incident Centre was helping to coordinate the distribution of essential materials. Professor Murphy and I were in attendance there at midnight, and we saw that work. We saw the team, and I want to thank the team led by Secretary Beecham and the National Incident Centre head, Celia Street. So these matters, including the masks, thermometers, scanners, all going out, all being implemented, all being distributed. I've also spoken with the New Zealand Health Minister, David Clark, to make sure that we're coordinating and working together, and he was very thankful for Australia's cooperation, and we are thankful for their work. New Zealand will have more to say in the near future, I imagine, on the basis of our discussions. In relation to the Australian Medical Assistance Teams, I can confirm that the AUSMAT, or Australian Medical Assistance Team, with its mobile hospital, has arrived in Christmas Island. The personnel are in place to receive the passengers from Wuhan, and we expect that that flight should be collecting within the next 24 hours. And they are establishing, and the advice I have from the director of the National Critical Care and Trauma Centre, which runs the Australian Medical Assistance Teams, that's Len Nataris, is that the personnel are in place and the mobile hospital should be completed today. And again, at this stage we are not expecting people to be ill there, but they are fully prepared, and I think that that's a very important message for the Australian people, fully prepared. In addition to that, the AUSMAT team will accompany the flight to Wuhan to assist with any screening or other medical detection services at the point of embarkation, but in addition to that, they will be on the flight to make sure that all the protocols are followed, and finally to ensure that if any passenger were to fall sick, that they were immediately taken care of. I might ask the Chief Medical Officer, Professor Murphy, to provide an update on the virus and the reasoning behind yesterday's advice from the AHPPC, why it was made and what it means.
Thank you, Minister. So, as you know, this has been an evolving outbreak and we have been regularly reassessing every day. Yesterday, AHPPC came to the point where we believe that the spread of the virus outside of the Hubei province, in other provinces of China, while still relatively small numbers, represents evidence of sustained human-to-human transmission in those provinces. And we and other countries have now broadened our definition of the cases of potentially infected people to include anyone who has been in mainland China who has relevant symptoms. A corollary of that is that extends to our travel warning, and it also means that given that we have undertaken a precautionary approach to quarantine people who had come back from affected areas, that used to apply just to Hubei province, but now it is applying to people who've come from mainland China from the 1st of February. We don't think it's necessary to consider people who've been in mainland China before that because case numbers were very, very low. They're still quite low. The risk to travellers from mainland China other than Hubei province remains low, but it looks like it will be increasing and we want to be absolutely secure. Clearly, quarantining a whole range of people, tourists, non-citizens from China generally would be an impossible task, and so we recommended to government that measures be taken to substantially reduce the traffic of people from mainland China coming into this country, particularly tourists who have trouble self-isolating. So that approach is about Australian citizens, permanent residents and their dependents coming back and self-isolating for 14 days, which they can do in their own home, but essentially dramatically reducing the traffic, and that enables us also to enhance our border screening measures for that much reduced volume of traffic and make sure that we are able to accurately detect any person who may be unwell, but also make sure we provide that information to people if they become unwell later. The reason we're taking this approach, which is fairly extensive and has had significant impact on people, is because we, like the World Health Organization, still believe that this virus is capable of containment. At the moment we are working on containment. We're obviously reviewing every aspect of the epidemiology on a daily basis, but we have only had 12 cases yet in Australia and they have all been successfully contained. Minister has mentioned, it's been very positive that 3 of the cases have been discharged. Generally, the cases seen in countries outside of China have been relatively mild, and we do know that there are a lot of mild people with this disease. However, it's too early to say definitive statements about the severity of this disease. The data from WHO suggest 18% have a severe disease and about 2% mortality, but we still haven't sufficient data to make confident assertions about that. So we are doing everything we can to contain the spread of this virus in Australia, and we don't apologise, but we do understand that this has made a significant imposition on many people. Thank you, Minister.
Commissioner Mike Outram, Border Force.
Thank you, Minister, and good morning. As you're all aware, yesterday afternoon the Prime Minister made an announcement including that all travellers arriving from any part of mainland China, regardless of nationality, will be subject to enhanced border control measures to ensure the health and safety and well-being of our community, of course. The decision of Cabinet taken yesterday afternoon was fully implemented in a matter of a few hours. And that's a testament really to the cooperation and coordination between not just the Australian Border Force, but Department of Agriculture and their biosecurity team, Health Department, health officials, and of course state and territory health officials too. Because of that sort of cooperation, Australia is incredibly well placed to respond to ill travellers and passengers that may be at risk of contracting infection with border isolation, surveillance and contact tracing mechanisms and arrangements already in place. We in the Australian Border Force are responding to the most up-to-date expert medical advice from the CMO, as you just heard, and we will continue to work with other government agencies, including the Department of Health. The messages, though, for travellers need to be made explicitly clear. Australia will deny entry to anyone who was in or transited through mainland China on or since the 1st of February 2020, with the exception of Australian citizens, permanent residents, immediate family members of Australian citizens and permanent residents, including spouses, minor dependents and legal guardians. Air and maritime crews for whom we are satisfied have taken appropriate prevention measures. These enhanced public safety measures, however, will apply to those people. At 9:30 p.m. last night, on the 1st of February, I issued a direction to airlines and industries. And the effect of that direction is that if you have been in mainland China from the 1st of February and you are not an Australian citizen, permanent resident, immediate family member, etc., do not travel to Australia at this time. If you attempt to travel to Australia, either directly or indirectly, your airline will not allow you to board the flight. If you do arrive in Australia and it is determined that you have been in mainland China on or since the 1st of February 2020, your visa will be cancelled and you will be placed in an alternative place of detention for a quarantine period. Please do not attempt to travel to Australia unless you are an Australian citizen, a permanent resident or an immediate family member until these measures are lifted. Permanent residents and immediate family members of Australian citizens or permanent residents who do not hold a visa and have an urgent need to travel should apply online and request priority processing through the Home Affairs website. We are seeing, since the implementation of this measure already, significant impact, a beneficial impact, a general downward trend in passenger numbers. And for example, in Melbourne we were expecting about 5,000 scheduled passengers to arrive from China. We're now expecting about 700 over that 24-hour period, so there's a significant downturn. In Brisbane we were expecting 220 and we're now only expecting about 97. Overnight, 71 passengers were denied uplift in China and 12 flights have been cancelled today. 80 flights so far have been processed. So again, I just want to end on that message to travellers overseas. Please do not attempt to travel Australia unless you are an Australian citizen, a permanent resident or an immediate family member until these measures are lifted. Thank you.
Thank you. Happy to take any questions.
Minister, when was the decision made to no longer charge evacuees for the flight from Wuhan to Australia, and why did Peter Dutton not know about that this morning?
So the Prime Minister and the Treasurer, in consultation with colleagues, have made that. The Treasurer has made that clear, and that's been made subsequent to additional advice from the Department of Foreign Affairs and Trade.
But why did the Home Affairs Minister not know about that when he went on Sky News this morning?
I think the point was that the Treasurer was announcing it this morning. Thank you.
Professor Murphy, Peter Dutton also this morning warned any Australian who is remotely planning on going overseas for a holiday to reconsider that. Is there any medical, scientific advice or otherwise for that recommendation to absolutely not leave the country?
Look, I think Minister Dutton was probably saying that you should be careful about where you go. I think so. Well, I think I wasn't part of the discussion with Minister Dutton, but I think it's always sensible when you're planning to travel to consider the health advisories at the time. But at the moment, the medical advice is principally around China.
And our message is very clear. Take precautions, follow the travel advice, and that travel advice says do not travel to China.
But sorry, you have a cabinet minister saying don't travel anywhere. That is conflicting advice. Who are Australians supposed to pay attention to, the medical officer or the minister?
Look, I'll respectfully check the transcript on that. Thank you. Next. Yep.
Professor Murphy, Peter Dutton this morning said that Anastasia Palaszczuk had breached the confidence of chief medical officers and was talking out about the travel ban before it was officially announced and indicated there could be issues with the committee being so forthcoming in the future. Are you able to say that Anastasia Palaszczuk has denied that there was any breach of confidence and that she wasn't a party to any meeting? Are you able to say whether any confidence has been breached, and if that will cause any issues for the committee going forward.
I'll let the Professor speak to the processes, and I'll deal with any of the issues about governance.
So I'm not aware of the statements or what Premier Palaszczuk said. All I can say is that the HPPC Committee of Chief Medical Officers has worked incredibly closely together, entirely collaborative, and made all of our decisions on a unanimous basis, and we're meeting 2 o'clock every day for the foreseeable future, and there's absolutely no discontent or discord between any members of that committee.
Yeah, so I have to say, today we had a meeting with all of the states and territories. We thanked all of the states and territories, both at officials and at ministerial level, for their cooperation. Queensland expressed no dissatisfaction, and I have to say that the Chief Health Officers at state level have been exemplary. They have provided their advice fearlessly, and we have accepted their advice. As to the Queensland Premier releasing any of that advice before it was considered by the National Security Committee, that's a matter for the Queensland Premier to explain.
Commissioner Outram, can you step us through what's happened this morning at airports with the arrival of some of those flights from China? Can you tell us how many people who've been in mainland China did arrive at airports in Australia this morning? How many were put in detention? How many were turned back on return flights? And how many might have been allowed through if they were in a healthy condition?
So I haven't got the total number of people who arrived, but I've given you some examples of 700 in Melbourne and 70 plus in Brisbane. So that gives you a sense of the scale of the number of people arriving. People who, of course, were on an aeroplane that was in the air before the direction was given to the airlines, of course, they're subject to previous arrangements. But still, they've been met on those flights by biosecurity officers, and they've been asked questions, and they've been subject to health screening, including by state and territory health officials. A small number of people, as I understand it, were then taken for further screening at a hospital, but that's like a handful, 2 or 3.
And so how many, were most of them allowed into Australia?
Yes, because as I've said, the effect of the decision that was implemented at 21:30 last night is that anybody who is not in that category of exemptions that I've listed will not be allowed uplift, and 71 passengers were denied uplift overnight.
Sorry, what's this denied?
David.
Denied
I just
uplift
want to
means...
be clear on the, there's a lot of jargon in these circumstances. What
Okay,
does denied uplift mean?
Yeah, I'll do it in plain English. They weren't allowed to get on the airplane.
On departure for
On
Australia.
departure from China, they weren't allowed to get on the airplane. Their visa was cancelled.
Commissioner,
Thank you.
do you have information on further states? So what happened in South Australia, what happened in Western Australia?
It's the same measures nationally. At all international airports, the same measures are being applied in the same way.
The number of passengers who came in last night or overnight?
We'll provide you those statistics of the amount of flights that came in overnight, but what I'll say to you is the main message there is that the number of passengers coming from China has significantly reduced since yesterday afternoon. A number of flights have been cancelled. The number of passengers coming on flights has significantly reduced, and so, as I said, 5,000 scheduled for Melbourne, down to 700. So the decision, the announcement of the decision, the direction that we've given to airlines has taken immediate effect as we intended.
I will add that all state and territory ministers and their officials reported that the measures which the Commonwealth imposed and requested have been implemented on the ground, and that's an extraordinary turnaround.
Minister, you say you expect that flight to leave Wuhan within the next 24 hours. Has China agreed to that flight yet?
My understanding is that everything is proceeding appropriately. On the specific details, I'll respectfully leave that to Minister Payne.
Sorry, just to be clear, because there's confusion about that as well. This morning, one minister suggested that that hadn't been received. You seem to be confident that it has.
Well, we are proceeding, but I'll leave any details. And one of the things we're doing is we're being cautious about preempting the official Chinese position out of respect for that nation. And I think you can understand that in the circumstances, that respect is a very important thing to do. And so I will leave any formal declarations and announcements to Foreign Minister Maurice Payne.
Some Australians, though, feel that we've perhaps been a little bit too respectful. We've seen other nations get their citizens out, but we still don't even have authority to.
I think what you'll find is we are one of very few countries. There have been a couple, but we are one of very few countries to be able to enact this process, and we're doing it carefully. And what we're doing, though, is making sure we're covering all of the qualifying citizens. And there have been a variety of terms and circumstances around the situation with some of the other countries. We have a very broad application in terms of Australia, and we're making sure that we were able to process, uplift and receive. And when you think of the whole of the world with citizens in China, we are one of the very few.
Professor, the Prime Minister, the Cabinet, they've all been taking your advice. Would you say that you've acted appropriately thus far? Would you have responded to this crisis differently? Do you think you've acted fast enough, and is there a need for a national disease control centre?
So when we say my advice, the advice is that of all of the State and Territory Chief Health Officers who, as I said, are meeting daily. And we have reviewed this situation. We have reached an absolute consensus of opinion. There's been absolutely no dissent from any of the State and Territory Chief Health Officers. We believe that we have been one of the most proactive countries in the world. We were probably the first country to introduce a quarantine period for Hubei residents on the basis of the potential for asymptomatic transmission, and we're one of the few countries to do this step. So I think we have acted proportionately and appropriately on the emerging evidence, and there has been a clear consensus view from all of the State and Territory Chief Health Officers, and we're working very closely together.
I'll just follow up on that. Oh, sure. So firstly, in relation to the advice of the Chief Health and Medical Officers from around the country, they were tasked with one clear responsibility: frank and fearless advice. Don't try to preempt any of the other considerations. Give your medical advice. And each day I've reaffirmed the sanctity of that advice to the Chief Medical Officer, and we are blessed with arguably one of not just the best Chief Medical Officers in the world, but also one of the best network of Chief Health and Medical Officers in the world. And they have been frank and fearless, and where they have advised, we have adopted. And as Brendan says, not only were we one of the first in the world to implement the 14-day quarantine, we are one of the first of the world to adopt this next step. And where they recommend, we adopt. Yesterday, Professor Murphy advised the Prime Minister and myself in the morning that he believed that the grounds had changed and that should be considered. The Prime Minister asked if the Chief Health Officers could bring forward their meeting, and that we would then schedule a National Security Committee meeting following that. Both were done, both are implemented. In terms of continuous glucose monitoring?
Yeah, would you consider rolling it out to all Australians with type 1 diabetes, not just those that hold their...
Well, I'm delighted to announce that we have now expanded access to the flash glucose monitoring system, so this should help 58,000 Australians. And what we've done is an unprecedented expansion. It's a $300 million program. It will make a real difference. And so we started with nothing. We then expanded that to the under 18s. We have pregnant and nursing mothers. We've now expanded it to Australians of all ages who are concessional card holders, and now we've added, once the company has accepted the terms that were put down by the medical experts, flash glucose monitoring. So we'll continue with this program.
Roll it out to all Australians.
Well,
there's 100,000 that have...
Again, what we're doing is continuing to follow the medical advice, which is a broad principle, and I couldn't be more thankful that this is a signature day for people with diabetes, and I know that Diabetes Australia has absolutely welcomed what we've done.
Minister, do you support Bridget McKenzie as a Cabinet Minister?
Yes.
So just on the quarantining, could you please explain how that might impact air crew who are obviously flying to and from China, or Commissioner even? Are they going to have to self-isolate once they stop working?
I can answer that. Our view is that we're working with airlines. We think that if aircrew are wearing personal protective equipment, which is probably just a mask and gloves when they're in close contact, that would prevent them from any material exposure, and we wouldn't want them to be quarantined, but we'd want them to be wearing personal protective equipment when they're in contact with passengers.
Similarly, obviously, the arrangements at the airports will similarly apply to crew as they do to passengers in terms of the screening mechanisms.
All right. Minister, we've heard why Bridget McKenzie should resign. Why shouldn't she resign, in your opinion?
I've made my position clear. I'll leave that to... I know there's a process which the head of PM&C is doing, and frankly, at this point, I'm focused on the coronavirus. Thank you, everybody.
Do you know why the process is taking so long?
I understand it's an ongoing process.